We all have a lot of questions about the vaccine distribution. When can you get one? And if the state is getting them into people's arms as fast as possible. WMAR2 News' Eddie Kadam sat in as senators asked the acting health secretary questions that are on the minds of so many people.
The Senate Vaccine Oversight Workgroup had their first of many oversight meetings tracking vaccine distribution in Maryland.
There is nothing more important in the state of Maryland than our collective efforts to get vaccinations into arms.
To start, there was a slideshow showing a reduction in vaccines put into arms this week compared to last week. Looking at CDC data as of January 23rd, Maryland is ranked 40th for vaccines administered per population and ranks 3rd in percent of unused, with around 59% of vaccines not distributed.
Data collection is understandably difficult for everyone during this initial vaccination and during this whole coronavirus pandemic. You will see different numbers from different places. And in the right-hand column, that's what the CDC says has been distributed to Maryland. And the left column is what MDH reports.
A few weeks back, Governor Larry Hogan appointed Dennis Schrader as acting health secretary.
What we're doing is very carefully building the infrastructure so that as we get more doses, and we're hoping by the spring and summer, we'll see a very large increase if another couple of vaccines come on the market, if the administration is able to get more production out of the two manufacturers we currently have, that'll bring us more doses. We want to have those channels open.
Before the Senate Executive Nominations Committee decides if they'll back Schrader to permanently take the job, they will hold these meetings weekly.
By opening up one seat and adding another 700,000 people into the mix, it's only making it harder for these teachers that are in 1B to get to this process. So can you explain why we moved so quickly into 1C?
Schrader said the federal government forced the state's hand to move into the next phase. Senator Addie Eckhart was concerned with Walmart and Giant providing shots, that it would be more difficult for people in her counties to get shots from the health department.
Are we taking the amount that would have gone to the health department to give them to another entity in the meantime? Because that means that...
Yes, the answer is yes, absolutely.
But that's not fair. With all due respect, that doesn't seem to be fair when there are people waiting in line to get a vaccine with their health department. Why would we open up another entity taking away their allotment?
We can't wait 3 months to put these capabilities in place and find out that we're not ready when the federal government starts to send us lots and lots more doses.
Right now, there are around 2 million people eligible to get the vaccine. They will hold these oversight hearings every Monday. For WMAR2 News, I'm Eddie Kadam.